Welcome to Swell Back Pain Clinic, and thank you for opening this video. Hi, I'm Lawrence Bergstrom. I'm a registered osteopath and a non-surgical spinal decompression specialist. I want to talk to you in this video about when your back pain is a medical emergency. Thankfully and rarely, medical emergencies in terms of low back pain are few and far between, but they do occur. And number one, we want to safety net you to make sure if you need to, you can act swiftly to get the medical care that you need. One of the conditions I want to talk to you today about is a condition called cauda equina syndrome. Now, what does that mean? Cauda equina is Latin for horse's tail. Now, the horse's tail, or cauda equina, relates to a specific part of your spinal nervous system. And the cauda equina itself is a network of nerves that supply your pelvis, your pelvic organs, and your lower limbs. So they provide everything from control of your bowel and your bladder to forming sciatic nerves, the largest nerves in the body, which then provide strength, motor function, and sensation in your legs. Now, when everything's working well, we don't have any symptoms and we're quite happy. However, if we do have a problem with part of the spinal cord, and in particular in this region, in the lumbar spine, then we can have very serious problems if the underlying cause is not diagnosed. One of the key problems that can occur, rarely, but it does, is when disc material within your spine, and just to orientate you, this is a vertebrae, this is a vertebrae, this is the back of your back, and this is the front. And here we have windows that peripheral nerves pass through. And then in the center here, we have the spinal cord. When spinal disc material squeezes onto these nerves with enough pressure, it will damage them. And this becomes a serious problem very quickly. Now, I've suspected cauda equina syndrome a handful of times over the last 10 years. And in actual fact, it was last December, a patient was referred to me by their GP. It's the first time it was actually confirmed as cauda equina. Now, this was a young woman. She was in her early 40s. She had massive back pain. She was really struggling to move, couldn't sit, could barely stand, or had to lie down. And I asked her if she had any other changes in symptoms, such as was her bladder working as it normally would? Was her bowel working as it normally would? Her bowel was fine, but she confessed to me that she was starting to leak and she was wetting herself uncontrollably. I referred her immediately to A&E, where she received an urgent MRI, and then she was passed on to a neurosurgical team to perform what we call a surgical decompression, where they removed an area of disc material which was compressing those nerves. Because if untreated, you can suffer from permanent bowel or bladder changes, incontinence, or paralysis. So it's serious. Another thing to be very aware of is if you start to feel very unwell, if you're feeling feverish, if you're feeling out of sorts and just really feeling horrible, and you've got back pain which is just unrelenting, you can't rest from it in any position, whether you sit, stand, lay down, walk, doesn't matter, the pain is just unbearable. Again, at the very least, you want to call 111 or present to A&E. There's a possibility you could have an infection within your spine, and that needs to be addressed very, very rapidly. For gentlemen, if there's a past history of prostate cancer and you have back pain that's unremitting, again, straight to your doctor, and they will follow that up quickly with blood tests and medical imaging. Thankfully, most back pain, even very severe back pain, which we see every day of the week, isn't sinister. It's invariably related to some disc-related problem, facet joint problem, a mechanical and degenerative problem, or some form of tear to a material. Something else that's worth considering, of course, is a recent accident. A tumble down the stairs, a heavy tackle on the football field, falling over the cat, and then having persistent pain that's not getting any better. Again, you should be following that up, because sometimes fractures occur. People are surprised. They think, wow, that's unlikely to have caused any major injury. And sometimes it does. We all have different levels of pain tolerance. So hopefully this video has been useful just to prime your mind in terms of a few possible red flags, as we call them medically. We'd much rather you be aware of them and don't feel that you're wasting your doctor's time or your osteopath's time or even at A&E. We all know that staying at A&E can take hours and hours and hours and hours. But I was discussing this with a neurological surgeon a little while ago, and he said he would still prefer the patient to go to A&E and be sent away saying, no, there's nothing to worry about, off you go, rather than lie at home in agony thinking, I don't want to waste people's time. Because at times, time is essential. And if you leave it too long, then sometimes the end results can be severe or catastrophic. So hopefully this little explainer video has not frightened you, because very rarely are these conditions evident, but they do occur. And if in doubt, get it checked out. Thank you very much.